reasons we have not seen spread from all of these travelers. But also, I can address the issue of vaccination status of the cases. To date, about over 76% of the cases were either not vaccinated, a few were under-vaccinated, meaning they'd only had one dose of disease. So overwhelmingly, it is people who are not protected from measles. And remember, the measles vaccine is extremely effective, 2 doses giving you 97%. But that's still 3% of people who potentially can become infected. And also people who were vaccinated in childhood who now have an immunocompromising state can be vulnerable as well. That's why we need vaccine rates to be as high as we can possibly get them.
Before I say goodbye to you, Dr. Smith, just a couple quick questions. Do you get any immunity if you've received the first shot but not the second?
You do. You get about 93% immunity, which is great. It just isn't as good as if you get the second shot as well.
And I've got a listener named Cass who says, will students who already have medical exemptions be subject to the new California law?
Well, we can't comment on the law. I think I will say that it is still going through the legislative process. So no bill is complete until it's already gone through the full process and then to the governor's office.
Dr. Smith, good to have you with us. Thank you so much for joining us this morning.
Thank you very much.
It's Dr. Karen Smith, State Public Health Officer and Director of the California Department of Public Health. And we're going to continue with you, our listeners, and Dr. Erica Pond. And we do want to hear from you. Erica Pond directs the Communicable Disease Control and Prevention for Alameda County and the Department of Public Health. If you have questions about measles, not only in terms of what to do and, well, any questions that are on your mind, feel free to bring them forward now. In fact, let me give you a toll-free number. I know there's a lot of concern out there, and Dr. Pond ready and waiting for your questions. Toll-free number is 866-733-6786. You can join us now at that number. We invite you to do that. Again, it's 866-733-6786, or email any questions you might have to forum@kqed.org, or go right to our website and post questions there at kqed.org/forum. Click on the segment or tweet us. Our Twitter handle is @KQEDforum. And let's talk for a moment about the anti-vaxxers, Dr. Pond. And what do you say to people who, I don't know if you hear from them or not, but I've certainly heard from them through the years in covering vaccinations and so forth, who say, I don't want my child vaccinated. I mean, even those who say, we know that it's not related to autism now, that's been incontrovertibly proven, they will come back with arguments and concerns just about chemicals and so forth, and some of them certainly sound on the face of it legitimate.
Well, this is where I try to speak as a parent. I have 2 children who are fully vaccinated, and also as a pediatric infectious disease specialist and a public health official, that I am very confident that these vaccines are safe and effective, and they're the best protection we have for these vaccine-preventable diseases. I do want to learn how we can regain the trust of these communities that have lost trust in vaccines. Again, and one huge effort that I try to reiterate is I'm a parent myself. I understand we all want the best for our children. We all want to protect our children. And I can confidently say with all of my years of training and experience that this is a safe and effective vaccine. And again, it's the best way we can prevent disease in our own families and loved ones and our community. And as was mentioned before, it's important not only to protect your own children, but other infants or other people whose immune systems are compromised and others who don't have a choice. So if you do have a choice to vaccinate, please do, to protect yourselves, your loved ones, and our overall community.
Well, it may have even come as a surprise to many people when President Trump urged people to get vaccinations for their children, because he had come out almost sounding like an anti-vaxxer at one point.
Yes, I think all I can say is that I will reiterate again as well, there are a lot of myths, a lot of misinformation. There was one study that came out many years ago that was retracted. The physician that, created that study, his license has been revoked, but unfortunately a lot of myths prevail. And the other unfortunate thing is that it does feel like many communities have been targeted with misinformation. So many of these communities that we've had large outbreaks with in the United States have been targeted and given misinformation. And again, the science is very clear, and all of the large medical associations, the Centers for Disease Control and Prevention, and again, most importantly, as a parent, I can speak and say that the vaccines are safe and effective, and they are the best protection we have.
Well, all you need to do is go on the internet if you want misinformation. There's enough out there to, I think, last probably for infinity. I want to go to calls and emails, and again, you can join us at our toll-free number. It's 866-733-6786, or email us, forum@kqed.org, or simply go to our website, kqed.org/forum, and click on this segment. The California highest vaccinating rates now, I think, higher than any other state among kindergartners. Is that right? Do you know, Dr. Kwan?
I do know we have, especially now that we did pass the prior bill that Senator Pan introduced in 2015 after the Disneyland measles outbreak, that we have definitely improved our vaccination rates. And with